Introduction. Challenging the misconception. A common misconception exists that individuals with diabetes must completely abstain from sugar. This notion, while seemingly logical, is a dangerous oversimplification. Diabetes is a complex metabolic disorder characterized by elevated blood sugar levels. It's true that excess sugar intake can exacerbate this condition. However, completely eliminating sugar from the diet of a diabetic individual is not only impractical, but potentially harmful. The human body requires sugar in the form of glucose for essential functions. Glucose serves as the primary energy source for cells, particularly in the brain and muscles. While it's crucial for diabetic patients to monitor and manage their sugar intake, completely cutting it out can lead to serious health complications, including a life-threatening condition called hypoglycemia. This essay delves into the complexities of sugar consumption for diabetic patients. We will explore the physiological and biochemical needs for sugar, the dangers of sugar deficiency, and the importance of a balanced approach to sugar intake. By understanding the nuanced relationship between sugar and diabetes, we can move beyond simplistic misconceptions and empower individuals with diabetes to make informed decisions about their dietary needs. The body's need for sugar, a basic biological understanding. To comprehend the necessity of sugar for diabetic individuals, we must first grasp the fundamental role of sugar in the human body. Sugar, in its simplest form, glucose, is a carbohydrate, one of the three macronutrients essential for human survival, alongside fats and proteins. Carbohydrates, upon digestion, are broken down into glucose, which enters the bloodstream. This glucose circulating in the blood serves as the primary energy source for our cells. It fuels vital organs like the brain, which relies almost exclusively on glucose for energy. Muscles also depend heavily on glucose, particularly during physical activity. Without a consistent supply of glucose, our bodies cannot function optimally. Diabetic individuals, due to their condition, have difficulty regulating blood glucose levels. Their bodies either do not produce enough insulin, a hormone that regulates glucose uptake by cells, or their cells become resistant to insulin's effects. This leads to elevated blood sugar levels, which, over time, can damage blood vessels and organs. While managing blood sugar is crucial in diabetes management, it's equally important to recognize the body's inherent need for glucose. Completely eliminating sugar intake can deprive the body of its primary fuel source, leading to adverse consequences. Therefore, a balanced approach that considers both the need for glucose and the importance of blood sugar control is essential for individuals with diabetes. Glucose, the primary fuel source. Imagine your body as a complex machine with various parts working in unison. Now consider glucose as the fuel that powers this intricate machinery. Just like a car needs gasoline to run, our cells require glucose to perform their functions effectively. This analogy underscores the vital role of glucose as the primary energy source for our bodies. Glucose is especially crucial for organs like the brain. The brain, responsible for controlling every aspect of our being, from thoughts and emotions to bodily functions, requires a constant and uninterrupted supply of glucose. In fact, the brain consumes about half of the body's glucose reserves. Depriving the brain of glucose can lead to cognitive impairment, dizziness, and even seizures. Muscles, the workhorses of our body, also rely heavily on glucose, particularly during physical activity. When we engage in any form of movement, from walking to intense workouts, our muscles demand an increased supply of energy. Glucose provides this readily available fuel, allowing our muscles to contract and propel us forward. In essence, glucose acts as the lifeblood of our cells, providing the necessary energy for them to carry out their functions. Without sufficient glucose, our bodies would simply grind to a halt. This fundamental understanding of glucose's role is paramount when considering the dietary needs of diabetic individuals. Sugar and diabetes. Understanding the relationship. Diabetes is often perceived as a condition synonymous with sugar. While it's true that a strong correlation exists between the two, the relationship is far more nuanced than simply equating sugar with the disease. Diabetes, at its core, is a metabolic disorder characterized by the body's inability to effectively utilize glucose, leading to elevated blood sugar levels. This dysfunction arises from either the pancreas not producing enough insulin, a hormone that regulates blood sugar levels, or the body's cells becoming resistant to insulin's effects. Insulin acts like a key, unlocking cells to allow glucose from the bloodstream to enter and be used for energy. When insulin is deficient or its action is impaired, glucose builds up in the blood, leading to hyperglycemia. Over time, this chronic elevation of blood sugar can damage blood vessels and nerves, increasing the risk of complications such as heart disease, stroke, kidney failure, blindness, and amputations. Therefore, managing blood sugar levels is paramount for individuals with diabetes. However, it's crucial to remember that sugar itself is not the enemy. Our bodies need a certain amount of glucose to function properly. The key lies in finding the right balance between providing the body with the necessary fuel while keeping blood sugar levels in check. Section 5. Hypoglycemia, a danger of sugar deficiency. While high blood sugar is a hallmark of diabetes, an equally concerning and potentially life-threatening condition can arise from excessively low blood sugar levels, known as hypoglycemia. This occurs when the body's glucose reserves are depleted, often as a side effect of diabetes medications or inadequate carbohydrate intake. Hypoglycemia can manifest with a range of symptoms, including dizziness, confusion, weakness, sweating, rapid heartbeat, and in severe cases, seizures and loss of consciousness. These symptoms arise from the brain and other organs being starved of their primary energy source, glucose. For diabetic individuals, particularly those on insulin therapy, maintaining a consistent intake of carbohydrates, including sugar in controlled amounts, is crucial to prevent hypoglycemia. Skipping meals, strenuous physical activity without adequate carbohydrate intake, and incorrect insulin dosage can all contribute to hypoglycemia. Recognizing the symptoms of hypoglycemia and taking prompt action is crucial. Consuming fast-acting carbohydrates like glucose tablets, fruit juice, or regular soda can quickly raise blood sugar levels and alleviate symptoms. In severe cases, emergency medical attention may be necessary. Section 6. Carbohydrates providing essential energy. Carbohydrates often receive a bad rap, particularly in the context of weight management and chronic diseases like diabetes. However, it's crucial to remember that carbohydrates are not inherently evil. In fact, they are one of the 3 macronutrients essential for human survival, along with fats and proteins. Carbohydrates serve as the body's primary source of energy. Upon digestion, they are broken down into glucose, which enters the bloodstream and is delivered to cells throughout the body. This glucose fuels vital organs, including the brain, which relies almost exclusively on glucose for energy. For individuals with diabetes, managing carbohydrate intake is crucial for regulating blood sugar levels. However, this does not mean eliminating carbohydrates altogether. Completely cutting out carbohydrates can lead to an over-reliance on fats for energy, which can have its own set of health consequences. The key lies in choosing the right types of carbohydrates and consuming them in moderation. Complex carbohydrates found in whole grains, fruits, and vegetables are digested more slowly and provide a more sustained release of energy compared to simple carbohydrates found in processed foods and sugary drinks. Section 7. Sugar in moderation. The key to diabetic management. The crux of managing diabetes effectively lies in finding the right balance. A balance between providing the body with the fuel it needs, primarily in the form of glucose, while keeping blood sugar levels within a healthy range. This is where the concept of moderation comes into play, particularly with regards to sugar intake. For individuals with diabetes, completely eliminating sugar from their diet is not only unrealistic but also potentially harmful. Sugar in controlled amounts can be a part of a healthy and balanced diet. The key is to make informed choices about the types and amounts of sugar consumed, instead of reaching for sugary drinks, candies, and processed desserts, which provide empty calories and cause rapid spikes in blood sugar. Opt for naturally occurring sugars found in fruits and dairy products. These foods offer additional nutritional benefits like vitamins, minerals, and fiber, which can aid in blood sugar control. Moreover, it's crucial to pay attention to portion sizes. Even healthy foods, when consumed in excess, can contribute to elevated blood sugar levels. By practicing moderation and making mindful choices, individuals with diabetes can enjoy the occasional sweet treat without jeopardizing their health. Section 8. Balancing act, sugar intake and medication. Managing diabetes effectively often necessitates a multifaceted approach, involving a combination of lifestyle modifications and medical interventions. One crucial aspect of this balancing act is coordinating sugar intake with prescribed medications, particularly insulin. Insulin therapy is a cornerstone of diabetes management for many individuals. Insulin, a hormone naturally produced by the pancreas, regulates blood sugar levels by allowing glucose to enter cells for energy. Individuals with type 1 diabetes require exogenous insulin injections or infusions, as their bodies do not produce insulin. Many with type 2 diabetes also benefit from insulin therapy to manage their blood sugar levels effectively. The dosage of insulin prescribed is carefully calculated based on various factors, including an individual's dietary intake, particularly carbohydrate consumption. When a diabetic individual consumes carbohydrates, their blood sugar levels rise. Insulin helps to lower these levels by facilitating glucose uptake by cells. Therefore, it's crucial to maintain consistency in carbohydrate intake, including sugar, to avoid fluctuations in blood sugar levels. Skipping meals, reducing carbohydrate intake significantly, or consuming unusually large amounts of carbohydrates can disrupt this delicate balance, leading to either hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. Section 9. Smart sugar choices, making informed decisions. Navigating the world of sugar can feel like traversing a minefield, especially for individuals with diabetes. With so much conflicting information and misinformation circulating, making informed choices about sugar consumption can seem daunting. However, armed with the right knowledge and a sprinkle of common sense, individuals with diabetes can enjoy the occasional sweet treat without sabotaging their health. The first step towards making smart sugar choices is understanding the difference between naturally occurring sugars and added sugars. Naturally occurring sugars are found in fruits, vegetables, and dairy products. These foods provide additional nutritional benefits like vitamins, minerals, and fiber, which can aid in blood sugar control. Added sugars, on the other hand, are those added to foods and beverages during processing or preparation. These include table sugar, honey, agave, corn syrup, and other sweeteners. Added sugars provide empty calories and contribute to weight gain, inflammation, and other health problems. When it comes to making smart sugar choices, moderation is key. Instead of reaching for sugary drinks, candies, and processed desserts, opt for whole fruits, plain yogurt with berries, or a small square of dark chocolate. These options provide a balance of sweetness and nutrition, satisfying your sweet tooth without wreaking havoc on your blood sugar levels. Please subscribe now to join our community. Give a thumb to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Our channel, Medicine Health 360, has many more videos to bring the crucial, latest, and systemic medical and health knowledge with a simple approach to everyone for better health and a better life. We value your feedback and encourage you to share your thoughts.